Hello, I'm John Perry, and I'm joined by Representative Doug Wozniak. And Representative, let's talk about some senior issues. The terms Medicaid and Medicare are quite often used interchangeably by some people, and of course, that's not correct.
Good observation, John. I like to call these little vignettes that we do senior moments, because it's important to seniors to understand what their alternatives are going forward. So to differentiate between Medicare and Medicaid, Medicare is available to people that are age 65 or older. No matter what their circumstance is, they can qualify for Medicare. Inside Medicare, there's 4 specific parts. Part A, which is hospitalization. Part B is services outside of a hospital. Part C augments the original Medicare. And Part D is for prescriptions. Now, once you get into that system, it's important to look at all 4 parts. In addition to that, there is now a product called Medicare Advantage, put out by many hospitals and health systems that cover all the Medicare aspects, but also some other aspects that would be advantageous for a person to have. And then there's Medigap, which would cover everything else that Medicare doesn't cover. So you'd use that in conjunction with Part A and Part B and Part D. Now, when we look at Medicaid, completely different issue. Medicaid is available normally for people that are older, that have no assets, minimal amount of assets. So when we're trying to qualify that, we have to qualify first medically. We need assistance with daily living, and then we have to qualify financially. In other words, your asset level's got to be at a certain level for you to get into Medicaid. Now, there are programs out there now that are augmenting Medicaid such that you don't have to divest all your funds, which a lot of people don't want to do. But in order to qualify for Medicaid, sometimes you'd have to do that. The application process is very complicated. Medicaid has very strict rules. Some of those rules are made in Michigan, but most of them are federal. Now, the way that the rules are made in Michigan, they're supposed to be promulgated such that they're really not stricter than the federal rules, but sometimes they do make them stricter, which makes it harder for a person in Michigan to qualify. So if you are considering using Medicaid, there are many I's that need to be dotted, T's that need to be crossed, and it gets very, very difficult to do. But it can be done.
So it's one of those issues then where maybe sometimes looking or asking for some outside assistance is a prudent thing to do.
Well, I'd say the internet would be the first place to look and start gathering information. I think all of the counties and the area agencies on aging have a lot of information. We'll post that number after this. But I'll tell you, the Area Agency on Aging is like a clearinghouse. They understand Medicaid and all the programs that are associated with it, and it'd be very valuable for a senior to contact them.
Okay. Representative Doug Wozniak, thank you very much.
Thank you.
And thank you for joining us.